I'm going to discuss idiopathic epilepsy at 3 levels. I'll discuss canine idiopathic epilepsy, which is a convulsive condition that affects dogs up to the age of 2 years, but dogs that are under 2 years can also be affected. So the 3 levels of discussion will be the management of idiopathic epilepsy in dogs, problems associated with the management, and future prospects to improve the management of canine idiopathic epilepsy. Now, this condition actually is a condition that involves epileptic fits occurring in dogs, and the cause is usually unknown after diagnosis. That's why it's called idiopathic. The form of management is usually by the use of anticonvulsive medications, which are administered on the animal, depending on how often the epileptic fits take place. Now, the main medications that are used, we have a number of brands, but the most common one is phenobarbital, which is administered orally over a period of time. Now, problems associated with management are resistance to the medicines after some time. Usually, why we administer the medication is so that we can reduce the frequency of the epileptic fits. And if we have cases where a dog has like 5 fits per day, then after administration of the medicines, we expect that these 5 fits per day will actually reduce to 3 per day, eventually maybe 1 per day, eventually maybe only 1 per week. And after some time, 3 months, 2 months, 3 months, they should completely be controlled. Now, the issue comes after 3 months or after 4 months, when despite the administration of the medicines, you still have those epileptic fits coming back. That's the point where you realize that the medicines that you are using to control the epileptic fits in your dog are no longer working. So what do? When you take your dog back to the veterinary doctor, he's going to prescribe a different form of the same medicine. Probably do some more tests and then put the dog on different medication. Our experience tells us that once you put the dog on another medication, it might be able to control the fits or it might not. And if it's able to control the fits, then there's a possibility that you'll enter into another cycle of resistance after around 2 to 3 months, or it might come much earlier because the body already has the experience of the first medication. Now, why do dogs become resistant to these medicines? We have a number of research studies that have been made, and these studies say that indicate that the brain cells utilize glucose just like other cells to produce ATP, which is the main source of energy in the body. Now, the problem comes between fits. After a fit, there are very low levels of glucose and ATP that are still remaining within the focal area of the epileptic fits within the brain. So this means that with time, the low levels of oxygen, the low levels of glucose and low levels of ATP will make the brain to produce epileptic fit impulses even more. And this will also make the brain cells to become resistant to the medication that is being administered, anticonvulsive medication. So the low levels of energy within the brain cells is the main reason why you have resistance of the medication to the medicine that you're using. Now, let's go back into some historical background. In the year 500 BC, somebody called Hippocrates actually came up with an idea which says that let the medicine be thy food, meaning that let the food be your medicine so that you don't have to take medicines for your health. Basically here what is meant is that we should choose our foods wisely and very accurately and very carefully so that the food we eat actually works for our bodies, for our physiology, so that we don't become sick. Research actually has been done towards how nutrition can help our bodies. And currently, as we speak in human medicine, there's a lot of nutritional use to manage some diseases. For the last 100 years, diabetes, neoplasia, and obesity are being managed using nutrition. And one important diet that is being used is the ketogenic diet, commonly referred to as the KD diet or the keto diet. This keto diet is highly used to manage non-infectious conditions. Even cancer currently is being managed, is actually being controlled. And there are studies which indicate that people who have cancer actually use ketogenic diets to recovery. Now, in the veterinary field, not much has been done in terms of investigation, but the little research that we have indicates that in the branch of veterinary neurology, especially the management of canine idiopathic epilepsy, ketogenic diets are being used, and especially in the Western countries, a lot of clients whose dogs have been diagnosed with idiopathic epilepsy have actually tend to change the diet of their animals, of their dogs, and they've been seen to improve. Now, how does the ketogenic diet actually improve the outcome of canine idiopathic epilepsy? This is based on the content of the diet. Ketogenic diet is composed of around 75% of fatty acids, and then around 25% proteins, and very low levels of carbohydrates. This is important because it encourages the body to use ketones for energy instead of glucose. So the ketones that are being produced, which include acetoacetic acid, acetoacetate, and beta hydrobutyric acid, are highly concentrated within the body cells when the dog is being given ketogenic diets. And because of the high levels of the ketone bodies, when the dog undergoes fits, you don't have the problem with low energy levels within the brain cells, because after a fit, due to the presence of ketone bodies, the energy reserve that remains after a fit is over 60%. The initial one during the glucose, it's 60% above that which was there during glucose. So this means that you'll have a higher energy level within the brain cells. Fatty acids are easily traverse the blood-brain barrier, so they're highly concentrated within the brain cells. So the energy level reserve will be very high, and it will take care of two things. One, it will actually by itself, the presence of the energy will reduce the fits within the brain, because the energy level reserve is over 60%. And then secondly, it will also have a positive effect on the activity of the anticonvulsive drugs. They become more active, and we won't have the issues of resistance to the drugs. Kindly note, this information I'm sharing is for awareness only, for everybody who's watching this video. Otherwise, for any person or individual who has a dog that has got idiopathic epilepsy after diagnosis from a veterinary surgeon, then they are supposed to indulge the assistance of a veterinary surgeon or a small animal nutritionist. Thank you.